Choose Change California is a campaign that's increasing awareness of opioid disorder and provides an easy pathway to ask for help. Here to fill us in on their medication-assisted treatment program is Marlise Perez. Welcome to the show, Marlise.
Thank you so much.
Let's start off by talking about substance use disorder and what it is exactly.
Yeah, so a substance use disorder it's really a brain disease. It's a chronic relapsing brain disease, and it happens when it moves past a dependence on a substance. So it could be alcohol, methamphetamines, and opioids.
Well, we're talking a little bit more specifically about opioids because it's an epidemic. We're hearing a lot about it these days. It's causing a lot of chaos in people's lives. Are they addictive?
Yes, so opioids can be very addictive. And these are opioids that can be prescribed by your dentist or your doctor, and it can actually be as addictive in as little as 3 days. So folks really need to be careful, and if they find that they're having any symptoms, that they feel like they just can't stop taking the medication, they really need to seek some help.
Why would people be taking that type of medication?
Yeah, so there are opioids that are, like I mentioned, prescribed for pain, and there are definite uses for opioids, so I don't want to scare people into not using them, but they also have to really see, is it worth potentially the harm as well. So really they just need to be educated about it and understand that they can become addictive.
Okay, fentanyl, that's something you're seeing a little bit more of out here in California. Why is that dangerous?
Yeah, so fentanyl is a type of a synthetic opioid, and you only need a few little grains of it, like salt, in order to overdose.
Oh, wow.
Yeah, and so most of the time you're not going to be having fentanyl. Doctors may use that in extreme surgeries or things like that, so it's not going to be prescribed to you.
Okay.
But what we're finding is it's really ravaged the East Coast, and there were high numbers of overdose deaths, and we're really feeling the effects of fentanyl here in California now.
One of the things that you're trying to do to help with this epidemic, with this problem, is called medication-assisted treatment. Can you explain that?
Sure. So medication-assisted treatment, that can help individuals that do have an opioid use disorder. And what it does is it goes into the brain, the medication does, and just levels somebody out without them getting a high, so they can get back to their normal lives.
Is it something that private insurance or Medi-Cal is going to cover?
Yes, so we have been expanding services in Medi-Cal and also private insurance as well. So there are many places that individuals can receive this medication-assisted treatment, and also with counseling to really, like I said, get their lives back on track.
Medication-assisted treatment is also known as MAT. Is it working?
It is. It's highly proven. There are countless studies. This medication, some of it has been around as long as 30, 40 years. Like I said, it's very, very effective. It's evidence-based.
So this is a way to treat it. What if there's someone out there that, they're not sure if they need this type of treatment, or maybe they're scared about asking for help? What do you say to them?
Yeah, so that is one reason we have this campaign, and they can go on our website, choosemat.org, and they can read articles, get a little bit more information. They could even go and do an assessment to see maybe they're just dependent and they're not addicted, or maybe they do need to get further help.
But I guess it's good to know that there is help out there.
Definitely.
Because it has become a problem. And you would even say it's a public health crisis.
It is. So it is the leading cause of death still. 130 Americans die each day from an opioid overdose. So it is a huge problem, unfortunately.
How do you feel about here locally, what's being done? Is enough being done? Are you seeing people coming out and reaching out for help now that MAT is widely available?
What we're really seeing is the awareness increasing. There's also the life-reversing medication called naloxone, and we're seeing here in California with one of our projects, we've already had over 8,000 reversals in the last year. So we're getting the message out, and while we're really happy that we're helping people and saving lives, we really want folks to understand that treatment is available. This is a disease, and we want to get more folks in.
And it is the holidays, but anytime, especially now, is a good time to reach out.
Yeah, we find, unfortunately, around the holidays that folks may feel, maybe their lives aren't going so well, and so we unfortunately see a lot more overdoses. So we really wanted to, help folks understand that now is the best time to get help, and there's no shame in that.
Great. Marlise, thank you so much for coming on and sharing the information with us about MAT. And if you want some more information about MAT, go to choosemat.org.
This interview involves commercial content. The products and services featured appear as paid advertising.